Hi guys, Dr. Pam, how are you? And thank you for tuning into another session with Dr. Pam. We really appreciate when you tune into our YouTube channel. Do you know that we know that about half of the people that watch our videos haven't subscribed? Do us a favor and click that subscribe link so you'll be notified when we definitely release new videos. We always want to make sure that you're always aware of any changes in testing or anything that comes up new. And we also release videos very often. So you don't want to be behind. Be sure and subscribe. Welcome, welcome, welcome. And of course, we're going to do a practice question today. Dr. Pam will remind you that taking practice test questions is not studying. Studying is studying. Studying is spending 15 hours a week, 3 separate hours a day, an hour in the morning, an hour in the afternoon, an hour at night, watching my videos, having notes all around you. Everybody in your family, in your office, in your small world should know that you're studying for the test. You know how an alcoholic, when they stop drinking and they still smell like alcohol? Everybody should know you're taking the test. This is a huge deal, and you only want to do it once or one more time. So remember, studying is the key. Most of us are auditory processors, and we just don't realize it. In a live session, I'll always ask you, what is your favorite Michael Jackson song? And most of my clients can sing a couple of words. And Michael Jackson's been dead many times before some of you were even born. We do know that the auditory process works. So keep watching our videos over and over and over again. Everybody in your family should hate me. Your husband, your wife, I should be the only person allowed in your bed between you and your spouse. The goal is, if you study me for 90 days with my staff, then you will just do this one time and you'll be done. Remember that we have lots of clinical practice questions, but we don't believe taking questions is what you need to do. Okay. So remember, invest in yourself. You are worth it. When it comes to taking questions, we have two types. There are questions that I have to take the material and really understand it and follow the problem solving process. It's written for social workers. However, we use it in all theories. Remember that we assess first. We get paid to be nosy. That's our job. We chose this field. We were already nosy. Safety comes first. We always remember it's my client's safety, my safety. Every state has a duty to warn. The Tarasoff Act specifically says you have to warn the client. However, every state has a duty to warn if someone is in imminent danger of hurting themselves or someone else. And always, if feelings are in the question, no matter where we are in the helping process, feelings come first. If a client throws a chair, if a client is boohooing, we are going to address the feelings. Remember, reflection. Reflection is one of those active listening skills, and reflection means I'm going to always use the feelings words the client didn't say. That helps us establish rapport. And many times clients just don't have the verbiage. So reflection is what we use to acknowledge the feelings. Remember, after we're assessing, we come up with a plan, a treatment plan. Those are based on SMART goals. They're specific, they're measurable, they're achievable, realistic, and time-based. That's our goal, and our objectives lead to our goals. When we plan that, we're always planning with the client. We don't ever tell a client what to do. And of course, our intervention is going to be based on the theoretical orientation. Am I a feminist therapist? Does the question say based on a behaviorist? Is it based on solution focused? According to Carl Rogers, what would I do? That is where those interventions come from. And termination, of course, starts in the beginning. The minute a client comes in, our goal is how long will they stay with us? Most insurances will pay for 12 sessions. We can talk about solution brief focus that gives us 6 to 8. That's really a matter of setting the goals. If it's a hospital question, remember, the minute you check yourself in, they're trying to get rid of you. The other questions are what we used to call recall questions. Now, recall questions are not as simple as that used to be. We used to be very much at the bottom. Remember, understand. What are Freud's stages? What happens in the phallic stage? You very rarely see those questions anymore. The assumption is that you have a master's level education, you are highly educated, you're extremely smart. So you're going to have to use the Bloom's taxonomy, higher level skills. You're going to have to apply, analyze, and evaluate. You get a scenario and it talks about the group of people, and they're going to ask you to read this and to evaluate and make a decision on what's the best therapy, what's the best theoretical orientation for this group or for this person or for this couple. Right? I've got to analyze, draw connections between the ideas. They're going to give me, again, sometimes it will not even give me the theorist name. It'll just talk about the theory and give me some keywords, but I've got to figure it out. So it's important to learn content. It's really important to learn content, but memorizing content will not help you pass this test. You can know Freud's psychosexual stages all day long, but I promise you, you're going to get a question that is not as simple as you think. Most of my clients will say it's vague. So I let you know ahead of time, you have to know your content, but then you need to make sure that you can apply it to a question. Bottom line, it's a reading test. As we teach you, we're going to read the scenario, spend time in the scenario, whether it's one line or 4 lines. And then you're going to determine, based on the 4 questions, I'm going to determine which of the 2 could fit. I'm going to rule out 2 and then go back to the question. We'll see what that looks like in a question. So here's my question. I've got Linda. Linda is meeting with her client, Joe, for a regular session. Linda asked, if you could fix the biggest thing wrong in your life, what would it look like? This is an example of what? Now, many of you will pick the answer and you'll just go on and swear up and down that you're right. All I'm suggesting that you do is that you make sure you read all 4. So if you want to stop right now, answer the question, feel free to. Freeze the video, pause the video, and come back and watch. For those of you that want to make sure we learn how to answer all of the questions, not just the ones we've memorized, let's make sure that we learn all 4. Let's talk about the question. What is the question measuring? Every question is trying to measure a KSA, a knowledge, skill, or ability. You went to school for 6 years, and they're trying to measure, according to the text, according to state standards, do we know what it's measuring? So Linda is meeting with her client, Joe. It's this regular session, so I know it's not a first session. Remember, it matters what session it is. And she says, if you could fix the biggest problem that's wrong in your life, what would your life look like? This question is measuring either a particular theory, and remember, this is the intervention because my treatment plan is based on my theoretical orientation. Okay. The question is asking me about solution-focused therapy. Many times you will see brief solution-focused therapy. That is the one that is 6 to 8 weeks. It focuses on the solution, not the problem. Solution focus is present and future focus and future forward. And it really is developed to help the individual reach a goal or focus on, without focusing on the problem. It is the only therapy, I'll take that back. It's one of the few therapies that doesn't follow the medical model. The medical model is how most people work and how doctors work, right? You go to the doctor, you go to the dentist, you go to a lawyer, and they say, what's the problem? How can I help you fix the problem? Okay. So that is the medical model. Solution focus doesn't really focus on what caused the problem. We're going to acknowledge there is a problem. We're not going to ignore that. But remember, I have 6 to 8 weeks. I don't have time to go back into your childhood and what happened when you were 3. That's more of a Freudian. He's looking at your insight. It's going to focus on the strengths, not the weaknesses. So when is the problem not a problem? What's going right in your family? What's going right with you? We're not going to go backwards. We're going to work on going forward. All of these things I'm really trying to understand as I understand what the question is asking me. Remember, solution focus is focusing on what's right. The medical model focuses on what's wrong. Focusing on what's going wrong can be stressful and makes a situation look like there's no solution in sight. However, identifying what's going right gives the individual hope that everything's not so bad. 6 to 8 weeks. This is really many times what our EAP, employee assistant programs, are focused on. We're trying to fix the problem. Opponents of the solution focus would say it's putting a band-aid on the problem. However, that's not my question. I'm only focusing on what the question is asking me. This is by Stephen DeShazer. We don't really care. I very rarely see his name. And remember, I only focus on what can be on the test. Suppose that one night while you were asleep, there is a miracle and the problem that brought you here is solved. However, you're asleep because the miracle has already happened. So when you wake up in the morning, what will be different? Right? You wake up and suddenly things are different. That's called the miracle question. So this therapy has many different has techniques that it uses. So what we're looking for in the question to know it's a solution focus is the verbiage that would belong to the theorist. Solution focus also uses the scaling technique on a scale from 1 to 10. 10 is what if that miracle happened? Where are you now? Where do you need to be? What will keep you? Wow. What will help you move up at one point? And how can you keep yourself at that point? So let's say that I go to my therapist and I say that I'm really depressed. I'm so depressed I can't get up in the morning. I'm late to work. I have lethargy and I can't do anything. So he's going to say to me, Pam, if you woke up tomorrow and you weren't depressed, how would you know? What would life be different? So I'd say, hey, you know what? My alarm would go off at 5:30. I'd be out there singing with the birds, jogging. La 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 la. Okay, so that's the miracle. That's my 10. That's my 10. So when I come in every week, he's only going to ask me, how close am I to my 10? How can he help me get to my 10? He's not going to focus on what went wrong that week. He's going to focus on how do I get closer to my 10? Remember, if it's not a problem, we're not trying to fix it. So if there are days already that I can get up and do my morning jog, then he's going to say, what is the problem? Not a problem. That's called the accept question. So exploring, I'm going to focus on the description versus the exception. When is it not a problem? What does your 10 look like? Increase awareness of your current and past success. Turn past solutions into present solutions. Find out the specific. And like every other therapy, let's come up with a plan. So in exploring my accept questions, it's going to talk about when the problem is not a problem. Pam may say, I may say, hey, you know what? Every Wednesday, for some reason, I can get up and run. He's going to focus more on, okay, so that day's working. What's right with that day? And how can we have that day continue? So if the wheel ain't broken, we ain't trying to fix it. The accept questions can talk about, tell me about times when the problem doesn't occur. When does your partner listen to you, if that's my concern? Tell me about the days when you wake up more full of life. And when are there times you manage to get everything done at work? When is the problem not a problem? If I say on days that my children call me, those are better days. On the days that it's above 60 degrees outside, those are the accept questions. That is when the problem is not a problem. We're going to focus on those. So you may see a question that literally says, what is the accept problem? Give an example of the accept problem. I have to know that belongs to solution focused because that's the verbiage that is used. Remember, solution focused techniques include counter finding. Counters are the resources that are already present. Future perfect. Okay, we're looking at if you got woke up tomorrow, if the future was better, what would it look like? Of course, your scaling technique is your 1 to 10, and you're always trying to get to your 10. The accept questions are when the problem is not the problem. And we're going to affirm that, give you feedback that what we're doing, where we're headed, is in the right direction. 6 to 8 weeks, short and sweet. However, we're going to really focus on what's going right. So back to my question. Linda is meeting with her client, Joe, for their regular session. Linda says, if you could fix the biggest thing wrong in your life, what would your life look like? Now I've got my 4 answers, right? So then I'm always going to read all 4 and I'm going to rule out 2. Even if you think you know the answer, read all 4. If you learn this technique, when your anxiety is kicking your butt in the exam, you won't just go to what you think is the question. You will read all 4. Remember, we teach test taking skills, how to pass a standardized test. If we look at athletes, if we look at other professionals, they practice the same way they perform. The Super Bowl is coming up. Whatever teams make it to the Super Bowl, practice in the snow and the rain and the weather with the crowds roaring, and they go through the same steps every time. If you learn to use those steps, if you're train your brain, we're learning about, again, neuroplasticity to go through the same steps. When anxiety is kicking my butt, when my mood is up, I'm going to be able to go back on my training. Follow the same steps. So my choices are object relations theory, scaling, the miracle question, and motivational interviewing. Object relations theory is Margaret Mailer. Remember, that's object constancy. I'm looking for words like fusion. She also talked about autism, the first stage, babies just lay there. Her biggest theory is the fact is that if you don't have the same caregiver the first 3 years of life, then you're going to have difficulty trusting somebody. You won't have a secure base. Motivational interviewing, if you don't recall that does belong to the trans-theoretical model. Those are the stages of change: pre-contemplation, contemplation, action, plan. That will start off with drug and alcohol users, but definitely we use it now with other populations. And most of you use motivational interviewing in your everyday life. You just don't label it as motivational interviewing. That is helping the client realize that perhaps they have a problem, but we're doing it in a motivational style as opposed to yelling at them is what we used to do, literally. So I do know that both B and C do belong to solution focused. So I can get down to those 2. Again, even if I know or I think I know the question, I'm going to follow the concept, because if I learn the routine, when anxiety is high, I will still know the routine. So the scaling and the miracle question, I'm going to compare the 2 and go back to the question. Now, the scaling question has some numbers on a scale from 1 to 10. I don't see any numbers in that question. Do you? Pam, if you woke up tomorrow, what would your 10 look like? So I'm going to take out B and I'm going to go down to the miracle question. If you woke up tomorrow and that miracle happened, what would it look like? I realize for many of you, this was a simple recall question. For a lot of you, it was not. You're struggling to learn new theories. No matter where you're at on this theory, on the scale of learning, follow the same rules. I will never make you a better therapist. Sorry, that's not our goal. That is not the goal of our business. Our business is to help you walk out the path that I believe that your Heavenly Father has laid for you, or whatever higher power you believe. You need the license to get where you need to get to. I'm teaching you how to pass the test to get a license. You're already a great therapist. You'll get better with years of experience and you'll get better with supervision. But please don't ever, ever think that there's a correlation between having a license and being a good therapist. So, again, solution focus is the miracle question. I'm going to amplify what the client wants, concrete behavioral measures that we can measure those terms, and very realistic. The key concepts of solution focused, again, it's 6 to 8 weeks. It's brief. We're focusing on the positive, what's going right. Don't fix what ain't broken. I currently live in the South, so we'll use that. If the individual or group or couple is already doing something that works or something that helps, then let's move toward that solution. If there are days when the problem is not a problem, let's figure it out. Okay. So more of the key concepts is we're going to focus on what works and do more of it. In addition to not making changes, they should do more of what is increasing the chance of the results. Stop doing what doesn't work. If it didn't work before, why do we keep doing it? If an individual discovers their actions do not work, do not focus on the problem, the weakness, or things that do not produce results. If it's not working, we don't have time. We've got 6 to 8 weeks to really focus on getting this current problem fixed. We would love to see you in a live session. We know that many of you need a coach, a mentor, and someone just to bounce ideas off of. We're here. We are experts in this area. We are a very unique tutoring company. All of our staff members are licensed. All of our staff members have gone through Dr. Pam's tutoring program. And we really just want to support you and help you get this sheet of paper. We truly believe there's a bigger calling on your life. So make sure you subscribe to the YouTube channel because we try to release videos as often as we can. And this is our website where you can always sign up for classes. We offer groups. The NCE groups are every Saturday at 6. Social work groups are every Sunday at 6. You can go to our Facebook page or our website to find the current topic. Remember, with every individual session that you purchase, group sessions are included. We definitely agree that if you buy the bigger packages, you get a bigger discount. And we do take Klarma as well as we have some payment programs. We just want you to do it once. Please stop spending time and money. Stop taking the test 5, 6, 7 times and buying more material. Just learn to understand the material that you already have. Remember, you already have you've spent 6 years in school learning this stuff. You know it already. We're just giving you the verbiage that you need. I also want to remind you, no matter where you are in your path and your journey, you're exactly where you're supposed to be. I know that sometimes it seems that I am lost and maybe I'm in the wrong profession. When times are tough, even when you have no idea why you're doing what you're doing, and even when you have the urge to compare yourself to others, you're always exactly where you need to be. There's a season for everything. Trust your higher power. Trust the season. Put in the work, put in the effort to become the very best version of yourself. I hope I see you in a live session. I hope that you pass the test that next time and get off this Ferris wheel of taking the test over and over again. You're worth more than that. Bye, guys.